Welcome, All Stars. We are so glad to see you. Thank you for joining us today. You know we love you, and thank you for all of your emails and texts and just conversation. Anybody you want to see on the show, this is your show. Just let us know, and we'll try and contact them and get them on for you. Stay with us. We'll be right back. I'm Judge Angel, and I was his full-time sitting judge for over 2 decades. I've seen a few things, but there's good in everyone, and we are here to motivate and encourage you to be all stars. Sit back, relax, and enjoy. All stars, we have a great guest for you today. Her name is Ms. Marvelyn Navarro. She's a registered dental hygienist. How well are you taking care of your teeth? Let's find out. Marvelyn, thank you for joining us.
Hi.
We're so happy to have you here.
I'm so excited to be here. Thank you.
And folks, I have to tell you, her teeth are white. Not cream, but snow white. They're beautiful.
Thank you.
Now, you are a registered dental levels of our dental hygienist?
So in order to be a registered dental hygienist, that does include a 4-year degree.
Wonderful.
Yes. So you would have to go through all the training in order and also pass a licensure exam in order to be a dental hygienist.
Wonderful. So education is what we build our whole show on. So congratulations to you for doing that hard work and getting the extra degree and the certificate. Thank you very much. So most of us have 2 sets of teeth, the baby teeth and our adult teeth. What are some things that just in general everybody should be doing for their teeth?
That's a great question. Not many people know how to take good care of their teeth or how to keep them, right? Like you've mentioned, we've only have those 2 sets of teeth. We have a saying in dentistry, it's only floss the teeth you want to keep, or be true to your teeth or they will be false to you, right? So we definitely recommend that you go to a dentist and have dental checkup, x-rays by a dentist, also keep up with your routine cleanings, but most importantly, the work is at home. You do have to brush twice daily, floss twice daily, and I highly recommend a water pick because that will flush out bacteria from underneath your gums.
So you're saying brush twice a day, that's morning and night, that's an easy one. And floss with the string twice a day?
Yes,
that's
morning
a hard
and night.
one.
It is. But do you want to keep them? Only the ones you want to keep, right?
Okay, good. And what else do? We floss with that string. Oh, the water
pick.
Can the water pick be substituted for the string?
Now, the literature states that you should still floss with string floss and also water floss, right? Just because you want to make sure you eliminate any kind of food that's impacted in between your teeth, get it out with string floss. And then the water pick can come in and flush beneath the pockets, your gum pockets, and flush any bacteria or food from underneath the gums.
So it sounds like you're saying we need to do both twice a day.
Yes.
That's the best way to guarantee that we're taking care of our mouth. So if you don't do those things, what are some of the problems that can develop?
You can develop many problems, and one of them is gum disease. And gum disease is an infection that forms around your tooth. And you can either get pus or you can have bad breath, or many things can form from gum disease. There's also an oral systemic link or a mouth to body connection, we like to call it. And what they have found is any kind of that bad bacteria that we have in our mouth can travel through your bloodstream underneath your gum tissue and affect other parts of your body and cause heart disease or diabetes, just to name a few. And there has been studies that show that the same strand of plaque that they find in heart disease is the same bacterial strand that is in our mouth.
Wow. That makes a difference.
It
That
does.
gets our attention.
Yes.
Yeah. So people that don't want heart disease, that don't want diabetes, we can help ourselves prevent some of those things
You definitely
by
can.
excellent oral health care.
Right.
Twice a day, folks, for everything. So for me, that means early in the evening, I have to eat, and early I have to do these things, because it's like once I get sleepy,
I
I
know.
tell you, I start stumbling like, where is the bed? So I've got to change some time habits. Well worth it, I'll say. Now,
Definitely
when
is.
people get gum disease, it comes from not brushing and not flossing. And they have the signs of, you said, pus and swelling.
Yes.
I imagine toothaches.
Toothache, some other signs is consistent bad breath that won't go away. Even if you're brushing your teeth and this bad breath won't go away. You can see spaces in between your teeth or bleeding while brushing and flossing or starting to see some of your teeth are becoming loose. Or you can also see plaque or tartar buildup accumulate around some of your teeth.
Oh, yeah, that's serious.
Yes.
And it's interesting. How frequently should a person go to a dental hygienist?
So I would say you have to visit your dental office at least twice a year to maintain a healthy oral environment, right? So we want to make sure that you get your dental x-rays to rule out if there's any cavities or decay going on in your mouth or in your teeth, but also keep up to date with your dental cleanings. Now, it definitely depends if you have oral hygiene that is healthy, right? A healthy gums versus you have gum disease. If you have gum disease, then you can visit the dentist more frequently. I would say every 3 to 4 months.
Okay, so really taking care of our teeth helps our entire body.
Yes.
And in order to take care of our entire body, we've got to really make sure we're following these procedures on a daily basis, 7 days a week, or is it a day
Yes.
off?
I am truly a big believer of it, right? I have seen so many changes in a patient's health when you eliminate the gum disease from the mouth and eliminate that type of inflammation that is going on in your mouth that can then travel to your body.
This is so important, thank you, because it's a silent kind of situation. And most people really don't think about it if there's no pain. It's like, I don't have any pain. I went to the dentist last year. I'm good, but not necessarily, because you're talking about inflammation, which we wouldn't necessarily see. Particularly, what about those back teeth?
Right? You can't really see in the back teeth the majority of the time. So you would kind of ignore them. I would say a lot of patients or people in general go to the dentist when they have an issue. And when they have an issue, it's kind of too late at that point. They need either to get their tooth pulled or they're in a state of disease and they need to get that treated as well.
Absolutely. This is so good. So when you have gum disease and you're getting the bleeding or the inflammation or having pain, you go to a hygienist. How do you treat gum disease?
So you would go to your dentist. So the dentist would be able to diagnose if you have gum disease or not, and then the hygienist would step in. So one of the key indicators to diagnosing gum disease would be we take measurements of the pockets around your teeth. And there's different ranges that determine either if you have healthy gums or unhealthy gums. And I'll kind of go into that. So if you have pocket measurements that are 1s, 2s, and 3s, you're in the green. That is healthy, right? If you go to 4 millimeter pockets below the gums, that means you have active inflammation present. And the way we do this is we have a probe. And it's almost like putting a stick in water to see how deep water is. We have a probe with measurements on it, and we'd put it below the gum line, and it would give us a reading of how inflamed or not inflamed your gums are. So 4s would indicate gingivitis, which means inflammation and bleeding of the gums. Now that is reversible because you're in an early inflammatory state. But say you have anything greater than a 5 millimeter pocket. That is, you're getting into advanced periodontal gum disease, and that is not reversible. And there's actually no cure for gum disease once you are in that stage.
Once you are in the higher numbers.
Mm-hmm.
But if you're 1, 2, or 3, at that level, you can reverse it?
So you can reverse when you're in the 4 millimeter stage.
Oh, from 1 to 4.
Mm-hmm.
There's hope. Okay.
Yes. So the 1s, 2s, and 3s, there's nothing to reverse, right? Because it's already healthy.
Okay.
But when you're in the 4 millimeter stage, that means inflammation is active and that bad bacteria is starting to have a party underneath your gums, right? And we can either eliminate it and make it healthy again, or it's going to continue to try to destroy the foundation of your teeth, which is your gums, ligament, and bone. And once you lose ligament, once you lose bone and there's bone loss or even tissue loss, you can't get it back.
Oh my God. So if a person goes to the dentist and they have a 1, 2, and 3, they're good. What their routine is good.
Yes.
Let's say it that way. What they're doing at home is really working.
Exactly.
And evidently they would have a good routine set up for themselves. But if they have a 4, something is beginning to go on.
Yes.
And they need to step up their routines. I know. I'm talking to myself. That's how it works. But God forbid if they have 5, 6, 7s.
Or greater.
There's something greater than 7?
Yes. It's just the advancing gum disease. And once that bacteria continuously eats away down there, you continue to lose your bone around your tooth, your ligament. So then you will eventually lose your teeth.
Oh my God, if you don't go. All right, All Stars, you heard it here. Our registered dental hygienist is telling us we must take care of our teeth to take care of our body. And our body is our temple, okay? And we're mandated to take care of ourselves. Well, stay with us. We're getting ready to learn about some new technology. So we'll see you in 1 minute.
Introducing Healthy Cells Joint Health and Mobility, the revolutionary supplement designed to support healthy joint performance and flexibility. Unlike other supplements, it's not a pill you swallow. It's an ultra-absorbable gel. Simply shoot it straight down or mix it in water with a blend of potent extracts and lubricating nutrients, including curcumin, glucosamine, chondroitin, hyaluronic acid, and omega-3. Unlock the power of joint health and mobility for yourself.
Motivational moment number 1. Remember, All Stars, nothing is a waste of time if you can learn something from it.
My name is Mike Faust. I'm an independent broker owner of a First Choice Business Brokers franchise. I've been helping people buy and sell businesses for 17 years. If you're a business owner, whether you think a disposition of your business is right around the corner or years down the road, I can give you a very good idea of what the market value of your business is today, or I may be able to give you suggestions on how you could improve the value of your business for when you are finally ready to sell. Call me. I'm looking forward to working with you.
Motivational moment number 2. Be yourself. An original is always worth more than a copy. Welcome back, All Stars. Yes, thank you for joining us. This is such great information. Marvelyn Navarro she's a registered dental hygienist, is teaching us about good oral health. And it's just fascinating. Marvelyn, we were talking about gum disease. Now, how is gum disease treated, if possible?
So as mentioned, there's no cure for it, right? So we would only be able to maintain it. But the first line in defense of combating gum disease, you have a few treatment options. So one is the traditional way, which we call periodontal therapy. And this is where a dental hygienist or even a dentist would go in, get you nice and numb in some areas, and clean below the gum line to those very deep pockets that we measured, and clean all the calculus or maybe even tartar and plaque that you have calcified onto your tooth surface or even your root surface of the tooth. And we would clean that off to make it a healthy environment and flush out all the bacteria. Now, this route, we usually do it by tactile and feel, right? Or touch or feel. So as dental professionals, we go to school, right, for 4 years. Dentist goes for 8, but we definitely know our anatomy of our teeth. So we're able to maneuver around the tooth pretty well and get by. However, since we can't see below the pocket, we may unintentionally miss some areas. And those areas may not heal the way we would like it to heal, the pockets, because there may be something still left that we can't really get to, depending how deep the pocket is. Now, there's a second option. This option, you would be able to go to a specialist, and he's the periodontist or gum specialist, right? And this is a more invasive approach. It's surgical. So they call it a periodontal flap surgery, which means they would cut back your tissue, take it out of the way. They would clean around your tooth with a burr, which is a high-speed instrument, and clean off.
Is it rough, like taking rust off something?
Yes, pretty much. Plaque is very tenacious at times. It is on there and it won't budge at times. So
is it very thick?
It's thick. It's almost like biofilm, right? So you know how there's biofilm in our water lines, and you can see all the corroding of even water, right? That happens on our sinks. That can look the same way, but on our teeth and gums. It's biofilm that isn't removed properly and stays there and calcifies all around. So it kind of wants to live there and becomes part of your tooth, right?
Yeah.
But that's where either a hygienist or the periodontist would come in with the surgical approach, and he would remove it, and then he would sew you back together, maybe put some medicines in there, proteins to help heal, but it takes more of a longer recovery time with the surgical approach.
I can't even imagine. That sounds gruesome, actually.
Yes.
It does. So they cut a part of your gum in order to get under there where they can see. That's the point. They have to cut that gum so they can get under the gum and see what's actually going on.
Correct.
Oh my goodness. Before I forget, let me ask you, do you use any certain products or recommend any products or anything special? For instance, I'm thinking some people say they use salt water to rinse their mouth. Some people say they use baking soda. Have any of those things proven to really be of value?
So for healing, inflammation, and bleeding, warm water and salt rinses are recommended.
Okay.
It keeps the inflammation at bay, and it keeps the bleeding a little bit under control. And it's actually more soothing for a patient, right? It helps heal. However, if you don't go through with the gum disease treatment, it won't ever get better, right? So you'll just be in this repetitive stage of just using warm water, salt rinses, but with no true to help combat the gum disease.
No true healing.
Yes.
You said it. This can't be cured, but you want to suppress it, I think.
Yes, and maintain.
To keep it at a very low level so it's not taking over.
Yeah, so we can actually treat it, right, with one of the approaches, either traditional deep cleaning or surgical. There's one more we'll get into. However,
okay, I'm excited. There's a technology that's available in Las Vegas, and our special registered dental hygienist knows all about it. Let's tell our viewers about the technique that you have available and tell them how it works.
So I actually own a company with my partner, Katie Benavides, and I'm giving her a shout out today.
Shout out to Katie.
She couldn't be here, but we are both registered dental hygienists and both specialized and trained in dental endoscopes. And what this is a great technology, great machine for a minimally invasive approach to treat gum disease. And we have saved so many smiles with this and have many, many happy patients because they were able to keep their teeth. But what it is a small fiber optic camera that can magnify on a screen 48 to 100 times magnification.
Marvelous.
And we can see what is underneath your gums. So we would treat the patient with gum disease with a deep cleaning, but together, both the periodontal therapy and the dental endoscope provides more predictable and precise result because you can actually see below the gum line. And we don't need to flap any tissue back.
Oh, thank God.
we don't need to do any of that. And we We gently insert the camera explorer beneath the gum, and we clean at the same time around your teeth, so we can thoroughly remove almost all the plaque around and calculus around your teeth.
That's wonderful. And that gives a patient the opportunity to start from ground zero with a
Yes.
clean mouth, clean teeth, all the plaque removed. Now, if they've not taken care of their teeth, they can start now with a
Exactly.
routine that's going to serve them and keep them from having to go and have a specialist cut the gum.
Yes.
Oh my God.
And there's no downtime to the procedure with the dental endoscope. We numb you up locally. That same day, you can go to dinner with your significant other and have a blast. There's no downtime. There's
Wow.
minimal discomfort, and you can have great results in healing. But you do have to keep up with your water pick, flossing, and brushing at home, because that bad bacteria can reaccumulate within 24 hours.
Is that right?
Bacteria never sleeps, I tell my patients, right? They will continue to have a party if you let them. So you need to get in there. I'm a big proponent of self-care, right? And one of my favorite quotes is, "Your smile is one of the prettiest things you can wear."
Yes.
And that is on your face. So if you can
Yes.
take care of your face really well, why not have a beautiful smile to go with it, right? Include it in
Yes.
your self-care routine.
Absolutely mandatory. And so many people are very particular about their hair. They're very
Yes.
particular about their nails, all kind of great things. The key is to start with this mouth.
Yes.
Oh, we'll start with our mouth in many ways. What we say,
What we eat.
what we eat. That's right. And taking care of our mouth. That will
Yes.
have an effect on our entire body.
Exactly.
Keep us healthier for much longer. That is so good. So this technique with the camera, how big is the camera?
It's very tiny. It's on a fiber optic. I mean, there's a screen for us to work off of.
Yes.
So you can look at the technology on our website, right?
Good.
PerioPreciseRDH.com. We have some great pictures on there, and our social media also has great videos on how the technology is used. And you can see how patients are just laying there relaxing while we're actively working in their mouth like nothing's going on.
Well, that sounds marvelous. You're saying a patient is only numb. They're not put to sleep.
They're not put to sleep. Yeah,
Good.
they're
good,
awake.
Good.
So we turn on our music and we jam out. No, we're treating gum disease.
So how long does this procedure take? 3 or 4 hours?
It does. So it can take about 4 hours total if we're doing the whole mouth in one session.
Oh, okay.
Yes.
So do you usually do 2 sessions?
It really depends on patient preference. Some patients like the ability to just get it all done in 4 hours, right?
Okay.
But if there's patients that want to break it up, we can do half the mouth one day and half the mouth the other.
Good. Yes.
Mhm.
4 hours sounds like a long time.
I know, and you have to have
me.
your mouth open, so.
But tell us this. This sounds like a great technique. They can reach you on your website,
Yeah.
PerioPrecise.
Precise. RDH.
Okay, and R for registered dental hygienist. Okay, so they can reach you there. And what do they do? Where do they go? How do they get to this machine?
So not all offices have this technology. And the reason why is there is not many hygienists that are specialized and trained in the technology.
Mhm.
So you have to find an office that has a trained, specialized hygienist or even a dentist that has the capability to treat you. And if you don't have an office that has one, if you contact us, we would be more than willing to help you find a dental office or a dental provider in your area that can help provide the service for you.
Now, this is big. So a person that knows they've been lax with their dental care, or they have been to the dentist and heard some big numbers roll, they need to get to you and
Yes.
find out where they can go, which dental office, to have this machine used on them by a trained person like yourself.
Yes.
So if they contact you on your website, you will help them find a dentist.
I will.
Okay, because you're already at multiple dentists right now, aren't you?
So we are actually helping many dentists here locally in Las Vegas, Henderson, and Nevada, right? And help give
And you're
them.
in Reno.
I was in Reno speaking, yes.
Yes.
So we also educate nationwide all of our colleagues, hygienists, dentists, in regards to many dental products such as this technology, the dental endoscope. And even if you are not local here in Nevada, if you're somewhere else nationally watching this today, you can still reach us and we can put you in touch with a provider that we know of in their area.
Give us that website very slowly, please.
Okay. So it's perioprecise.rdh.com.
Okay, beautiful. And we'll have it below anyway.
Yeah.
But we want people to definitely get your service and be treated and get well.
Yes.
Well, folks, thank you so much for joining us to hear this part of the show. We've got a lot more coming. Stay with us. You're going to get some good information.
Thank you so much, everyone. I've enjoyed being here on Judge Angel's All-Star Show, and I'm so happy to be part of her family. Once again, I'm Marvelyn Navarro, a registered dental hygienist with Perioprecise.
I'm Congressman Stephen Horsford, and it's great to be here on Judge Angel's All-Star Program. Please check out the show and find out about all the all-star guests that Judge Angel has coming on.